Ryan Stanton here with ACEP Frontline, and today talking with our almost now co-host. We've had her on so much just over the last couple of years, especially this last year, Dr. Christina Shenvi. And we are here at Accelerate in San Diego, and the Teaching Fellowship, Phase 1 and Phase 2. Of course, you've done so much work with that and really making it successful. So thanks for joining us here on Frontline in person, and now for those watching on camera.
Yeah, thanks, Ryan. Great to be here as always. The Teaching Fellowship is going amazingly well so far. We have a group of almost 90 people in Phase 1. Phase 1, just to give a little spoiler for people, if you are interested in the Teaching Fellowship, Phase 1 is 5 days where we cover the basics that every educator should know. Things like educational frameworks, how to give feedback, how to teach on shifts, how to design a curriculum. And then Phase 2 is really more focused on leadership, career success. We have Amal Matu give a whole day on leadership and presentation, communication. And then one thing that I've added this year is a talk on negotiations.
All right, and that's what we're going to talk about today. It's not an excuse not to come next year in Orlando. It's just we're going to give you a teaser here. So give us a baseline. I mean, the name of the talk is Code Blue, How to Resuscitate Your Negotiation Skills. And I think physicians, honestly, are overall pretty terrible at negotiations for the most part. It's one of the areas like running a business where we think, as being a physician, we'd be good competent. And we lose money. So tell us about, let's dive into resuscitating our negotiations.
Okay, well, Ryan, first of all, let's think about, when do you negotiate?
Well, I mean, a lot of times, I just did because I'm the president of the group and how much I'm going to get paid this next year with negotiations. You have the financial negotiations as you do. I just rewrote the contracts for our non-physicians, for our PAs and NPs, and negotiating with them on that aspect of it. Will be physicians coming up. But also then, even within the clinical setting, if you want to call some of those discussions shared decision-making, negotiations with patients and families as we have this discussion. So it is something super common. It's just we're really good at getting run over. We're
good at getting run over. So you've highlighted an important point, which is we often think, negotiation, that's something you do once every few years when you're buying a house, buying a car, or negotiating for a new job or a new position. But we negotiate all the time. Admitting that patient, negotiating with a patient to try to get them to stay. I don't know if you have had this experience, but I have found that my children are natural-born negotiators. Man, they are cutthroat. You want to negotiate what movie to watch, where to go to dinner, what to eat. They all have strong opinions, and they will forcefully negotiate for their rights. So we negotiate all the time, is the bottom line. When we think, though, about more formal negotiation, here's your gimme question. What do you think is the most common emotion we feel?
Well, one that I feel is distrust. I think fear is going to be the number one.
Fear is number one.
But I think distrust. And so, because when I went in front of the PAs and NPs and says, we're changing your contract, the first answer was, well, why? Why do you have to change it? What are you taking from us?
Right. They want to protect what they have.
They want to protect and want to know what's the motivation. What are you trying to take from me? Versus I'm just trying to make a good business decision from a corporation that needs to be compliant with the Department of Labor to go ahead and knock all these things out. So it's very much a corporate kind of setup thing that needs to happen. But every time I do it, especially now, because my first contract coming out of residency, I got screwed big time. The point that underpaid, ended up paying my part of the taxes and the corporate part of the taxes, and was probably in the end making before taxes somewhere around $80 to $90 an hour to be the medical director of a 25,000 volume emergency department. And so now I naturally, when I see a contract, is the assumption of, not only the fear, but not only how are you going to try to screw me?
Yeah, a lot of mistrust. I hear that. But you're absolutely right. The number one emotion that we feel is anxiety. Maybe fear is a strong word. So anxiety. And what's interesting is studies show that if you are going into a negotiation anxious, you don't do as well. You're more likely to just back out quickly. And we all want to please people. We all want to be liked. So our natural tendency is to say, okay, I'll take the job. Pay me $30 an hour or whatever. I'll take the job. I'll do it, because we just want to get out of that uncomfortable situation. So part of negotiating or learning to negotiate is to allow the anxiety and do it anyway, but also ratchet down the anxiety by preparing well. So here's my 10 principles, and maybe I'll focus on just the top few.
Okay.
Since we only have 3 hours in this podcast.
Sure. As long as you want.
Number one is to maintain the relationship. Now, if you are negotiating a car purchase, you may not have an ongoing relationship with that car dealer. Now, you don't want to be a jerk about it, but it's not like you're going to go into work every day and see that car dealer guy, right? Mm-hmm. Whereas when you're negotiating with a potential future chair or division chief or colleague, number one, you want to maintain the relationship. That trumps everything else. So you don't want to go into it with an adversarial outlook. You want to be thinking this person is a future colleague, and also you want to be negotiating for what you might want. That said, you can try to negotiate everything. However, not everything is negotiable. Mm-hmm. For example, at my institution, it would not go over well if I asked my chair for a raise, because our salaries are fixed. They're fixed with our rank and years in rank, period. And I think that's a really good thing, because I wouldn't want, what has happened before, is that people who are hired after you somehow negotiate a higher salary even though they have less credentials and have less experience. So I think that's a good thing. So it helps to know what is negotiable and what is not. But first and foremost, maintaining the relationship. Second is you need to know what you want. So plan and preparing for what you want. And there's a lot of lingo in negotiations, your aspiration point, your reservation point, your BATNA, things like that. But really it comes down to what do you want, what are your alternatives, and what are you willing to accept? Those 3 questions. And that will be informed by your interests, but also just like when you're buying a house, you look at the recent comps, the comparable sales, to see what is reasonable for this, or the dollars per square foot in your area, things like that. Your aspiration point or what you want will be informed by things like the going rate. How are other people being paid? How are the decisions made in that institution or that department? What have others who have a similar role received? Or if you're negotiating something like FTE for a position, what do other people who have this position at this institution or comparable institutions get? So you need to know, plan and prepare for what you want. And third, you need to do your homework. You need to know what they want. What they want is in some ways more important than what you want, because they are the ones who have the job, opportunity, the money, the position, whatever it is. So if you go in and say, well, I want this position as core faculty, and I want this protected amount of time and this CME budget, that's probably not going to fly. Whereas if you go in and say, what are the needs that you have right now? Now you can listen, spend a lot of time listening in negotiations. The more information you have, the more well-poised you will be to negotiate. Because maybe they don't say, oh, we need a core faculty member. Maybe they say, we need someone to lead our simulation work. Great. Well, as an educator, you can say, I have an experience in education and have gone to the ASAP Teaching Fellowship where I learned about simulation. So the point is you can reframe what you're looking for to fill their need.
All right, so we've got our first 3, maintaining the relationship, know what you want, and doing your homework. And especially with the first one, maintaining the relationship, because I think in ways, I think there's 2 approaches that people use. One is you come in as a bulldozer, kind of nitpicking everything. And those are frustrating. But I also feel like that combination of 1 and 2, I think physicians oftentimes, when you're coming into a contract negotiation, that's during good times. That's when you both want each other. It's like the beginning of a marriage. But the contract is when it goes sideways, for the most part. I mean, it does say this is what you're going to get and whatever. But the majority of a contract is the prenup that says this is what happens when it goes sideways. Yeah. And I think physicians a lot of times, they see these things with the assumption that it's never going to go sideways. Mm-hmm. And so making sure that you understand that if it does go south, where does this contract put you? What is the advantages they have, and what are the potential advantages or shortcomings, shortfalls that you're going to have if it goes sideways? A lot of times that is looking at the due process and how do we do disciplinary stuff, and what are the outs for each side. There's a lot of it there that I think we need to, as you mentioned, the maintaining the relationship, knowing what you want, and doing your homework. A lot of that is getting into some of that idea of looking at it from what happens if this marriage falls apart.
Yeah, absolutely. So we've got maintain the relationship, know what you want, know what they want, so take their perspective. And if you're prepping for a negotiation or an interview, I encourage you to role play not just as yourself, but role play as your counterpart, as the person that you're going to be negotiating with. So if you're the applicant, practice role playing and negotiate as if you were the vice chair or the person who's doing the interview, because then you can really sit in their shoes and try to take their perspective. And if you can, get as much information. If you have a buddy who works there, call that buddy up, say, hey, what are they looking for? What's the going rate? What are the things that can be negotiated? The fourth one, really important, is to focus on interests, not positions. Your position may be, I want to have 0.25 protected time and be in this core faculty role. That may be your position. Or your position may be, I want an assistant medical director role. Your interest, though, is what is causing you to have that position. So, for example, your interest may be, I want a career in education. I ultimately want to be a PD, and so being core faculty or an APD is going to help me get there. Or your interest may be, I want to learn how to do hospital operations and improve ED admin, so I want to roll as assistant medical director. If you come in just with your position, then it could be a non-starter. Well, we don't have an opening in APD roles, so if that's your position, we're done. We have nothing to talk about. Whereas if you come in with your interests of, I'm looking for an opportunity in education where I can make a meaningful impact, well, now there may be lots of things. Maybe it's core faculty, maybe it's ultrasound education, maybe it's simulation, similarly for admin. The classic example of this, where you can't go to a negotiation lecture without hearing this analogy, is there were two chefs who were both making different recipes, and they both needed an orange. They needed a whole orange. There was only one orange. You can imagine, those cooking shows when they're running around and there's only one orange left and they both want it, so, results in
and they both have
fisticuffs.
knives.
And they both have knives, yes. So what can they do? Well, they can either cut the orange in half, but now neither recipe is really getting what it needs, or they can look at what is their interest. Both chefs have the position of, I need that orange. If you look at their interests, well, it turns out one chef needs the juice of the orange, and one chef needs the peel of the orange to make that, candied peel stuff. Now, all of a sudden, you've changed the discussion, because now you can actually both get what you are interested in, and you wouldn't have elicited that if you just stuck with your position of, I deserve the orange, my recipe is more important.
All right, so number 4, focus on the interest, not the position. And honestly, I think that's important anyway, because sometimes in order to move up, getting that runway there of kind of getting the foot in the door and going. I didn't come into my current group saying I plan to be president of the group. It's doing the shifts, getting to know people, building relationships, and then kind of getting that far. All right, number 5.
Yes, is building credibility and doing well at small things so that then you can be offered bigger things.
Position yourself from the inside.
Exactly. Okay, so number 5, I would say, is to look at it from a multiple issues perspective. If you are negotiating on only one item, say it's salary, that's a zero-sum game, because maybe they are motivated to not give you a higher salary, and you are motivated to want a higher salary, and if they give you a higher salary, then they are losing money. So you can think of it more like with buying a house. It's a one-item issue if all you're focusing on is the price. But there are tons of other things that could be negotiated. Maybe they are looking for somebody who's going to be a nocturnist. they have lots of docs who are, getting older as we do, who don't want to work nights, and they are looking for somebody to cover a bunch of nights. Maybe you actually already wanted to be a nocturnist, or maybe you're willing to do it. Now you have something you can negotiate on. Well, I'm willing to do nights, but I want to set my own schedule. Or is there a night shift differential? Or can I block off certain weeks because I want to go to the teaching fellowship? Or can I have additional CME funds in order to cover XYZ? Or can I have certain periods off when I want to, when I have a grant that I'm going to be writing due? So making it about multiple issues, or it could be, we need people to cover our critical access site that's further away. Okay, I'll do that, but then in exchange for something. So make it not just about one issue, but expanding it to multiple issues allows you to have more nuance, and you get the juice, I get the rind. Then we're both happy.
Love it. Yeah, and I think that's important too, because especially for emergency medicine. I remember one of my resident colleagues, he came out and looking for the number, then got a great contract, just something that was probably at least double what the rest of us were getting. And, looking at from the multiple issues perspective is what makes it they're going to give me this. And that's what I tell a lot of residents is if somebody's willing to give you a lot more money, they're going to take out something else. Mm-hmm. There is going to be a value that they're going to take from you, whether it's the patients per hour, the risk exposure, the coverage. There's a lot of different things that to look at from out there. And I do think that the first contract, I think residency programs have gotten a lot better at this. The first contract coming out is usually the worst. Mm-hmm. Just because the money that you're talking is so much different than the money you've dealt with before. It's actually positive money. It is, it's the first job, it's the first attending, it's the chance you're seeing the house, you're seeing the car, you're seeing being in charge, of your shifts, that I think it's very easy to make that early mistake. And thankfully the residency programs are now starting to do and assist and support and review and do all the things that you need to do. All right, we've made 5.
Okay.
Let's go for number 6.
Let's go for number 6, okay. Number 6 is to focus on your goal or your aspiration point. They've done studies where they had people role play negotiations, and in one group had them focus on their reservation point. That means like your walk-away point. So if I'm, negotiating a salary or negotiating to buy a house, and my walk-away point is $300,000, I can't spend more than $300,000. But my goal is for this house that I want to spend $250,000. I mean, these are low numbers. This is not in San Diego where you're buying a house. If I focus,
it could happen in Kentucky, though.
There you go. Anyone want to move to Kentucky? If wonderful. I focus on my aspiration point or my goal while I am negotiating, I will do better. My 7th one is strengthen your BATNA. So your BATNA is your best alternative to a negotiated agreement. For example, if I'm buying a house and I can't come to an agreement with the seller, my alternative is to stay in my own house, to rent, to go, live with friends, to go to a hotel. I have lots of different alternatives. If I'm negotiating for a job and I don't like that job, my best alternative might be to continue in my current job, to go do locums, to take some time off work, to go back and do a degree program, whatever other alternatives I might be considering. If I'm going into a negotiation and I have not a good alternative, I will be more likely to accept a bad offer because I am desperate. Mm-hmm. So if you could offer me a terrible job, but if I'm like, I just need a job, period, then I'll take a bad offer. So when you're going into a negotiation, even if it's just in your mind, if you can strengthen whatever your alternative is, yeah, I could go do locums. It's not as though I won't get a job. This is not the only job offer I will ever have. I can go do locums and go travel around and make that seem better in your mind than maybe it actually is. That way you're coming in from a position of strength rather than from desperation.
And I think a lot of physicians put themselves in difficult situations because they don't allow themselves alternatives to begin with. Mm-hmm. In our hospital setting right now, the system is not making all the best decisions in the world, but the group has got this panic of, losing the contract or whatever. Well, I've got 27, 28 state licenses, so there's lots of small Democratic groups out there that I could work for at some point. And so that comfort of almost always having a better, what's your best alternative if this doesn't work out? Because I think physicians a lot of times will put themselves in difficult and challenging and career-shortening positions just because they don't look at the outside picture of what's the alternatives that are out there. And so you can make the most of what you have, knowing that if it doesn't work out, that you can willing to go somewhere else and do something else.
Exactly.
All right, so we got maintain the relationships, know what you want, do your homework, focus on the interests, not positions, looking at it from multiple issue perspective, aspiration points and goals, and then set your BATNA.
Strengthen your BATNA, yep. And then the last few, 8 is look for win-win situations. Try to make this about how can you meet a need that they have, and they will in turn help meet your needs, hopefully. And that's a way to expand the pie. We're looking at how can I get this slice of pie? Instead, look at how could you expand the whole pie? For example, a concrete example could be, of pie being money, could be maybe you're saying you want this thing, but you've come from another site where you helped improve the billing and coding because you went to the billing and coding conference of Accelerate, and you know how to now increase the billing for all your group. Well, now your slice of the pie, even if it's the same angle, is bigger because you've expanded the whole pie. So now there's more opportunity. And then next is just some ideas for practical tips and tricks. First, come in prepared. I have a negotiation worksheet where I go through what is my goal, what are my alternatives, what is my aspiration point, alternatives, walk away point, or reservation point. What is the competitive advantage or strategic differentiation that I bring? Maybe I've done a med ed fellowship, or maybe I've done a geriatrics fellowship, or maybe I know billing and coding, or I've been an assistant medical director. So what are those skills that you bring? And what are the things that can be potentially negotiated? And then a column for the same things for them. What are they looking for? What are the gaps that they have? What are their best alternatives? What are the things that can be negotiated or not negotiated? Maybe salary can't be negotiated, like we talked about. And then what are strategic things that they would be looking for? And doing that preparation and practice will make you a much better negotiator. Another tip or trick is to use silence. You'll notice throughout the podcast, whenever I want you to say something, I just stop speaking. And because you're a great podcaster, you then chime in with a nice summary or an example from your life. And in negotiation, the same is true. If you've reached a point where, I've made my desires, my goals clear, we've talked about the issues, I've listened, and then, come up with some opportunities, then I'll just sit back and wait and see what they will say. And often that will lead them to make some sort of offer. The other thing here, let's have some back and forth, is that you can repeat the last phrase that they said. So for example, let's say you're hiring, and I'm like, well, Ryan, tell me a little bit, just give me like one sentence. Tell me a little bit about what you're looking for in this position.
Well, what I'm looking for is great money. Pay me all the money in the world.
No, I'm interviewing with you.
Oh,
sorry,
you're
like the vice chair.
All right.
So Ryan, Dr. Stanton, thank you for interviewing me here. What is it that you're looking for in this position?
We're looking for the person that's really going to take us into the future and really kind of build us somebody we can count on. Mm-hmm. Actually, for my group, what it is we are looking for somebody looking for their forever home.
Okay, good. So now I could jump in and be like, I'm that person, pick me. I want this to be my forever home. But I really want to get more information. And now this is a point where I could use silence, but it might be a little awkward because you've just indicated that you've ended your sentence. Mm-hmm. Instead, if I repeat your last phrase, you're looking for people who want their forever home.
And then what does that?
And then you are
Yes.
going to respond. So let's keep the role
Yeah,
play.
we've got our, our group is made up of people who come here and stay the remainder of their career. We pride ourselves as being a group that where you want to come, stay, and retire with us.
Great. So now, just by repeating that last phrase, I've induced or invited you to open up a little bit more about what that means. Or maybe you say, yeah, we're looking for people in education. And I blaze in with, great, I can do all this education. But actually, you're not looking for GME education, you're looking for UME education. Well, now I've just boxed myself into, I can do GME education. As opposed to if you say we're looking for someone in education, and I phrase back to you, oh, you're looking for someone in education. Now you're going to elaborate. Yeah, we need somebody to be our clerkship director. Great. Now I haven't stepped in it and boxed myself into GME, and I can say, oh, well, here are the skills that I might bring. That's a great, great technique. Finally, just doing the dance, we often feel a little bit better if we have make people feel like they're getting a good value. Imagine you're going to buy a car, and the list price is $35,000. And you think to yourself, I'm going to go in, I'm going to negotiate, it's going to be great. And you go to them and say, well, the lowest I can possibly pay is $34,000. And they say, sold. What do you realize all of a sudden?
They definitely would have gone lower.
They would have gone lower. You left money on the table. Whereas if there's a back and forth and you work your way down to, $33,500, but they're like, don't know, or maybe we throw in the floor mats and go back up to $34,000. You've done the dance, you feel like you don't have that winner's remorse or regret that you may have left something on the table.
And I just hate them having to go talk to the sales manager because it seems like wasted time.
Oh, it's a total waste of time.
Yeah, they're back there playing solitaire or
They're
something.
totally.
Yeah.
Yeah, they're like, oh, I don't know if I can do that, Ryan. Let me go talk to my manager.
sales
and
manager.
I'm like, fine, go talk to your manager.
I got this clown out there. You mentioned, going back a little bit, because you bring up a very important part of the silence and the gaps. And podcasting is very easy when it's very clear with the tone on a sentence of when people are coming to the end. On occasion, I'll have somebody that interviews that it's just very quick, which of course you can edit out the odd silence after that, or it's somebody who does kind of a close but then cranks back in again, and that's when we end up stepping on each other. When we're practicing, negotiations, how important is it to have that practice that you have not necessarily predictable, but at least a cadence that allows them to know kind of where we're heading with kind of the wrap on this conversation or that question or a response that may be there, just so you don't have that weird, awkward moment where nobody knows what's coming next.
Yeah, I guess part of that is just not being awkward, which I don't know, maybe I'm not the right person to teach that, but I would say if you are the interviewee or the person who is, negotiating with somebody in more power, you need to err on the side of listening. I would not want to cut you off mid-sentence or end of sentence. I want to make sure there's a stop and then a little pause, which is difficult because my tendency is to jump in. But if I'm the one who's asking for something, then I want to allow you ample time to speak. And I want to err on the side of listening before I speak so that I can understand what it is that you want, and then I can show you how I can meet all these needs of your program. But then, yes, make it a conversation. It shouldn't be a monologue on either person's part. If it is, then there's probably some other factors that need to be looked at. And then have a good, usually there's a natural ending point or a what are the next steps. Maybe they do need to go talk to their finance person and think about it. Or you can ask them, what are some next steps? That puts it back in their court of they need to come up with an offer letter or something.
All right, so let's run the list. All right, well, number 1, we're maintaining the relationship. 2, know what you want. 3, do your homework. 4, focus on the interest, not position. Number 5, look at it from multiple issues perspective. 6, aspiration point and goals. 7, set your BATNA. 8, look for the win-win. 9, I may have combined 9A, 9, because theoretically there's a 9A, 9B, and 10A or B, whichever. Come in prepared. What do you bring and what are they looking for? And then finally, use silence and do the dance.
Yep, perfect. And if you want to learn more about this, read more about this, one of my favorite books on negotiation is Never Split the Difference by Chris Voss. And that's a great book on practical skills and ideas for negotiation.
All right, so next year we are in Orlando. I think I had the dates here. There we go. January 24th through the 28th, 2027, at the Disney's Coronado Springs Resort in Florida. So your pitch for getting folks there for the teaching fellowship.
Well, if you are an educator or an aspiring educator, then this is the course for you. We have grounded it in educational theory. We make it very practical, things you can take home and use tomorrow. And most importantly, it is the opportunity to network with other rising star educators in EM. And the 35 years of the teaching fellowship that's been running, we have an amazing alumni network that then you become a part of. So these are the people who you will collaborate with, do projects with, run into at ASAP and Cord, and just kind of grow up in the field with. So I would love to see anybody interested at ASAP Accelerate next year.
All right. And then how can folks get in touch with you if they have any questions or thoughts or comments or whatnot?
You can reach me at cshenvi@med.unc.edu. I'd be happy to hear questions or comments.
All right. Appreciate it, as usual. I guess I'll be interviewing you again in a couple weeks, maybe. That seems like when it'll come back around.
Probably. Thanks, Ryan.
Yeah, appreciate it. As for me, you can contact me, rstanton@acep.org, rstanton@acep.org, at EverydayMed on X. Make sure that you're subscribed to the podcast on whatever your favorite player is, so you're getting all the episodes, especially as we expand the network. And give us a 5-star. Show us some love so it boosts us up in the rankings so we can get out in front of more people. And until next time, I'm Dr. Ryan Stanton, and this has been some ASAP Frontline.
If you're not on the front lines, you're on the sidelines.
Cue the music.
Bow, bow, bow.
There. Quiet place, all
Yeah.
alone. Da, da, da.